Welcome back to KTN Prime. Many thanks for staying with us on the broadcast. It is almost 2 months since Kenya announced its first coronavirus infection, but the Ministry of Health is yet to make arrangements to accommodate all its frontline medics who serve at the heart of the COVID-19 pandemic response. KTN News has learned that healthcare personnel on the front lines still have no accommodation, despite the ministry confidently informing Kenyans that this had been done. Here is Dr. Masikori reporting tonight on the danger this poses to you and I.
When the Ministry of Health was taken to task about having accommodation for healthcare workers at the front lines, the confidence in which the response was made left no room for doubt.
The Kenya Medical Practitioners Dentists Council, chaired by Dr. Evan Jenga, are working extra hard to be able to get us extra facilities so that healthcare workers who get into contact with these cases don't go home.
That was on 7th April, but 1 month later, it is still business as usual for the 152 healthcare staff assigned to the isolation units in Kenyatta National Hospital and Mbagathi. One of the hotels is Hadassah Hotel in Nairobi. We are calling them to find out if at all any healthcare worker has been accommodated in this facility, and if so, at how much and who is footing that bill.
Currently busy. Please hold or call back later. Safaricom is for you.
Thank you for calling.
If I needed accommodation as a healthcare worker hapo Hadassah, is there a room, and how much is it?
At the moment, I don't have any available. Yeah, they are available. I have 32 there.
Oh, okay. So, is there? Sorry?
35.
Say again. 35.
Yeah.
Unasema ni how much?
Yeah, watu wa mimi. 5,000.
Mimi ndio najilipia ama ni ministry inalipa? In her response to Senate, Susan Mochache, the principal secretary at the Ministry of Health, indicated that they had procured half-board accommodation for 30 healthcare workers for 90 days at 12 million shillings.
We've actually gone there and confirmed that there are no doctors currently and health workers currently being housed there who are seeing frontline COVID-19. What they told us is that it's the surveillance team that is currently accommodated at Hadassah Hotel.
At the Kenyatta University Teaching and Research Hospital, out of the 170 staff at the isolation unit, 20 staff per week are accommodated within the complex. Other staff who are either single or living alone opted to stay home.
We also have another one which we identified today, which is Roeta Hotel Apartment, which is along Lenana Road. Any healthcare worker who is involved in the fight against COVID-19 is being taken care of. So the national government and the county governments shall not discriminate against any health worker, regardless of whether they are in public or they are in private.
Case 189, a healthcare worker, was the index case that sparked the spread of the virus in Kawangware. Case 209 in Kibra is a security officer attached to one of the government testing laboratories. When asked about the status of accommodation, the officials from the Ministry of Health walked away. Without such mitigation measures, as long as the healthcare workers are still freely mingling with the general